welcome everyone to our Sunflower House workshop, Caregiving 101. This is our fourth and final unit, which I think it's been a really good time and a really good experience. And I hope that everybody who's been joining us so far has found that it's been has been worth it. I'd love to have some comments and at the end. Why don't we start with introductions? And again, my name is Beth Shibley, and I'm the program director at Aging Matters in Brevard Sunflower House. It's a caregiver resource center at Merritt Square Mall. And I think we'll maybe go from first presenter through second presenter into third. So Jane, would you like to, Jane Peach, would you like to start?
Yes, thanks so much, Beth. I appreciate it. It's not good morning, it's good afternoon. I'm Jane Peach. I'm a clinical social worker. I'm a care manager for Assisting Hands Home Care of Brevard. And I appreciate this. Beth and I've collaborated on some other things in the past. And even though this isn't always new information for folks, it's such a good reminder with all of the work that we're involved in and just our own personal lives as well. My section is Keeping the Well Full, and it is going to define and look at the warning signs and talk about some relief for burnout, compassion fatigue, whatever term you want to use for that. I'm just going to start with a definition.
Oh, wait a minute, Jane, we're going to just do introductions.
Oh, sorry. That's it. I'm done.
Okay. No, we're going to put in that for now. Okay. Adrienne.
Hi. I'm Adrienne Cordero. I'm with a Viera Health and Rehab and Rockledge Health and Rehab. So that is two skilled nursing facilities in central Brevard. We specialize in short-term and long-term rehabilitation. Short-term, we really focus on cardiac, orthopedic, stroke type therapy. And today I will be presenting on fitness and taking care of yourself as a caregiver, but also for the patient or senior themselves. So this way you can prep just in case you have to go to rehab.
Oh my goodness.
Thank you so much. Christina, tell us a little bit.
My name's Christina Texan. I'm a social worker. In addition to doing some individual counseling for children and families, I work for and I'm on the board with Complementary Cancer Care. It's a nonprofit that provides support services for cancer patients, survivors, and caregivers. Started off in Brevard County, but we actually do everything on Zoom right now. So people outside of the county can also participate in different support activities, like exercise, art programs. I run the support groups and some other workshops. So I'll talk later on about benefits of peer support and networking and how that helps somebody's emotional health.
Terrific. Lana is also joining us from Assisting Hands. She's muted, but hi, Lana.
Hi all, I'm just here. I was busy the last couple and I'm super sorry I wasn't able to jump on. I love everything you usually have as resources and opportunities for us to listen and get educated a little bit about many facets. So thanks for having me.
Thanks a lot for joining us. And just quickly, Kathy, if you'd like to just talk quickly for a couple of seconds and introduce yourself to the group.
Hi, I'm Kathy Portlock. My boyfriend's mom had moved in with us back in November, and she has COPD, she has dementia. And we had a turn of events this last week. She fell, she broke her femur, so she is now in Holmes Regional Medical Center. And she will be going to a rehab afterwards. And after that, right now, we're not sure. She probably is going to need more help than what we can give. So that's where we are at this point.
Well, if you need my number, you're welcome to call me, even if she doesn't wind up in any of our centers at Viera Rockledge. I've been in this county for a really long time, and I can probably find you the best center that would, have the best capable hands and resources to take care of her the best.
Okay, I would appreciate that, please.
Absolutely.
Jackie, would you like to tell us a little bit about yourself and what brings you here today?
Sure. Yeah, I'm Jackie Greathouse. I am taking care of my mom. She's 80 years old. She has dementia. And just trying to navigate this new normal. I think I was explaining, thought I was an empty nester, and now I'm doing this. I was going back to work, then I was laid off at Corona, and God's just said, this is what you're doing, but you need to do it well. And I feel like I'm getting burned out. So I really appreciate this. All these resources are like water in the desert to me.
And Mona, you're brand new to us today.
Yes, yes. Hi, I'm Mona Shrafa. I'm new to actually Brevard County as well. I come from Broward County, Pembroke Pines. We relocated because of my husband's condition. He has tinnitus, very severe tinnitus. I had to quit my job. Thank God I could retire, though. Thank goodness I was able to retire as a teacher. And we are here, and I'm looking for lots of resources and trying to get myself adjusted as a caregiver also.
That's spectacular. So welcome, everybody. I think we're going to start now. Jane, you're back up on deck. I'm going to start by sharing my screen, and I'm going to be working the PDF for Jane. Let me see where it goes. There we go. And
Right.
Here we go.
Right. Thanks so much again, Beth, and welcome to everyone. So often we are told to take care of ourselves, and that feels pretty vague when you're in the middle of caregiving, personally and professionally. So this section is about just how do we keep that well full. Going to start with the definition of burnout. And if you read the definition, it probably fits some of the emotional and mental and the self-talk you're experiencing. It's a state of emotional, physical, and mental exhaustion caused by excessive and prolonged stress. It occurs when you feel overwhelmed, mentally and emotionally drained, and unable to meet constant demands. And what that is saying is your self-talk is going to sound like, I can't keep up. This is all too much. Sometimes it's more positive one day at a time, but they're all indicators that, there's probably some other warning signs going on. And those warning signs you may recognize and feel you can't address them, or they may be something folks point out to you and come to you. And when I was caregiving for 15 years, that is often what folks would say, Jane, here's what I see in you. So the warning signs are generalized fatigue. This is that sense I'm just tired all the time. I don't feel motivated. Everything feels, again, too much. Irritability is increased and patience is decreased. And so it's difficult for you to feel tolerant about everything anyone else talks about or brings up may feel petty to you. Extreme state of tension and stress, making errors in areas of your life that you normally don't make. We all lock our keys in the car once in a while, but if you do that 3 times in a week, it may be a sign that you need to address some of these symptoms you're having. Feeling overwhelmed, again, expressing that to others or just having those thoughts. Disinterest in usual activities. It's so easy when you just don't have the energy or tired all the time to avoid people, places, and things that you normally enjoyed. Not returning phone calls, turning down help from others, and then when we do that, we feel all alone. So these symptoms can be mild or more severe. They can cycle through just with thoughts and our feelings within days, or it may become more pervasive and really, hopefully, either through someone else's suggestion or support, we look for some intervention and help with that. Again, we may not recognize it because we're just in automatic mode. So again, pay attention to what other people are sharing with you. The next piece is, of course, what's the plan going to look like before these symptoms hopefully get too extreme or unbearable? Really increase your self-compassion through positive self-talk. Pay attention to what you're thinking about during more quiet times of the day, and look at if you need to reframe that. Connect with someone you trust, and also always consult your medical provider. You're the expert on you, and your self-awareness and recognizing the severity of these symptoms, it doesn't come easily. It's hard to slow down. And so again, how I framed it for myself and others is taking an adult time out. Build time in your week or even every day to help you check in a little bit. Know your personal limits and boundaries. We're all busy and multitasking. Say yes when you choose to, but also practice being comfortable saying no when you need to. Take time for yourself and ask for help. Identify, so it's clear for yourself and other people, who can help, what would be helpful, and what am I asking? What do I need? What am I actually asking for? And then you can move on to everyday plan of action and tools. This is going to be, as Beth and I talked about yesterday, this is so individual. But for me, and what I have read and shared with others over the years in practice, is that, you know, maintaining a routine, even in the chaos, if we have small events that are routine, it helps us feel more grounded and safe. I begin my day as if I'm putting on a life vest. I mean, that's kind of the metaphor I use, because I look at what's going to help me keep afloat today. And there are some emotional, mental exercises I do with that, as well as physical. So again, these are going to be very different for each person. Self-care strategies are very individual. I start with, I call it the threes. I have all these threes in my life. So that starts with 3 minutes of stretching before I even put my feet on the floor. So while I'm still in bed, I stretch for 3 minutes. I maybe take 3 deep breaths 4 or 5 times during the day. 3 things I'm grateful for in the morning while I'm brushing my teeth, and in the evening before bed when I'm brushing my teeth. So again, that's just, again, kind of a thing, what I came up with that was fun, and 3 minutes didn't feel like a big commitment. 3 glasses of water in the morning. So these are, you know, different things you can put in place just to kind of feel like you're giving yourself a hug. Other activities will be, again, very individual. Beth and I were talking, for her, it's working in the garden. That's very meditative. Meditation doesn't have to be sitting, you know, in the lotus position, trying to get rid of your thoughts. For me, it's just looking out at the bird feeder here and watching the birds. For some folks, it's knitting. So everyone has a place where they can feel peaceful and calm to kind of allay some of the symptoms in the central nervous system that put us in that fight or flight mode, and kind of push a little bit of adrenaline into our system that may make us feel more excited or hyper. Again, connect with positive people. Who makes you laugh? Say no to negative self-talk. And I use sticky notes. I have them on my bathroom mirror. I have them on my back door, you know, just reminders. I put them on the refrigerator. So whatever little tool you can use to maintain a sense of well-being. And again, as you're going to hear in today's workshop, what are the resources available? And create a large list of folks you can turn to for that need list, who can help. So that's a very brief overview of burnout, warning signs, and a plan of care, plan of action. But yeah, my contact information, if I can help in any other way with your family as they return home, or if you need assistance in the home, or just you just need someone to pick up the phone and call and speak to. Be glad to talk with you. Thanks.
Thank you.
Thank you so much. This is step share. Okay, there we go. I'm going to thank you so much, Jane. I think those were really interesting and insightful things that we can all use to sort of say, well, wait a minute here. I think, yeah, oh, this is more than just my regular, I haven't had a cup of coffee yet, anxiety or crankiness, when it's more. So, Kathy and Jackie and Mona, do you have any questions right off the bat for Jane? Are we good?
I'm okay. I would like to get her email again later.
Okay.
I didn't get it.
Yeah.
All right, let me see. Let me see if I can go back to screen sharing. Okay. Share.
Okay.
Can you catch that?
Got it.
JP? Okay, cool. Stop share. Okay, fabulous. And now I am going to move on to Adrian, who's going to talk about fitness and nutrition for us and for the people we're caregiving for.
Hang on just a moment. I'm pulling it up. Can you guys see that?
Yep.
Yeah.
All right. So again, I'm Adrian Cordero, working for Vieira and Rockledge Rehabs. On another note, I am also a personal trainer. I'm certified in many things. Pilates, kickboxing, senior fitness instructor, and just overall group exercise instructor. I can honestly say it's my first love until I met my child, fair enough. But I am no way, shape, or form a nutritionist, but I do try to practice good nutrition. So these tips and tricks, I really want you guys to just try to maintain and focus. And actually kind of piggybacking off of the first presentation, what you said, Joan, is it right? Jane, I'm sorry, I want to make sure it's true. Because, finding time to take care of yourself mentally, it kind of coincides with taking care of yourself physically. So I want to show ways to do that in nutrition and fitness for both the senior you're taking care of, if you are a caregiver, but also to take care of yourself. So that way you can help avoid the burnout. So let's go to the next. So I want to start with ways to eat healthy. I get it. I totally understand. I love me a good cookie or cake or anything sugar. I kind of have a big sweet tooth, but I also want to know in my everyday diet that what I'm eating is giving my body the benefit that it deserves, therefore fueling me for the next day and keeping me healthier and stronger. So first of all, especially for the seniors that you're caring for, brain and memory, obviously sometimes healthy fats and vitamin E is really going to help focus on that. So avocado, butternut squash, and broccoli. Sometimes I hide all these things in my family's dinner, so that way they don't even know that they're there, and it's a little sneak attack. But this way, the things that they say they don't like by themselves, you can find a way to add it in there. For your eyes to help as we age, we all know that we're losing our vision a little bit. I've been blind since 14. I wear contacts. I have pretty bad vision, but as a child, I remember always loving carrots and knowing that it would help my eyesight. So just really push that vitamin E. And of course, we know calcium helping your teeth, milk, bones, all of that. And to piggyback on that, to help with more calcium and things of that nature, there's a lot of different supplements that are out there. Collagen, even different types of collagen, you can find it online, and add it to already calcium dense type nutrients such as milk. So there's a lot of ways to really add that. For skin, vitamin A and C. So of course, citrus, dark greens, leafy vegetables, and garlic. I'm part Italian, so I love my garlic. And then just add it to all the leafy greens and you got yourself a good little meal there. So that's always delicious. Heart and digestive system, you want to, of course, add that fiber, a lot of wheat-based type things. We all know you can find wheat pasta, wheat bread, things of that nature. And of course, who doesn't love some dark chocolate? That's, of course, heart healthy, and avocados and every type of nut. So the great thing about nuts too is you can add that to everything. I always make little yogurt parfaits, and I add just regular Greek yogurt. I actually add a veggie powder and mix it in, little honey, and then a bunch of fruit and nuts on top. There you go. And of course, to help keep the muscle strong, which I think really helps, especially as we age, we lose that muscle density. So any type of protein, chicken, eggs, soy, anything of that nature. Any questions so far on any nutrition? Pretty standard, right? So when it comes to your fitness, so you're going to want to pair, of course, the nutrition with the fitness. You really want to target ways to help increase your balance, your gait, and your mobility. You can really do that just in everyday type activities by sitting. And of course, I'm happy to go over a couple of things here shortly. But before that, I want to talk about ways to help us get stronger together. Making the time to exercise can be difficult. Same thing as, you know, taking the threes. Just take time for yourself. I know it's difficult. Always, you know, try to have a support system. Maybe it's a neighbor, or I know a lot of apps and things online. And if you don't have access to online, again, having someone in person to really maybe go walking together, you know, sign up for one of these online type programs and do it together in your garage. There's a lot of free basic exercise type places that you can go to maintain during COVID and even before COVID, that you can basically have no excuses and just take the time, even just 10 minutes. There's plenty of YouTube channels such as Pop Sugar Fitness that have 10-minute easy chair exercises, stuff like that. So just find what you really and truly like. It could be swimming, it could be walking, it could be yoga, it could be anything. I think that's what I love the most about fitness is you can work every different muscle in so many different ways. You just got to find the way that you like it the most. As long as you're moving your body, that's all that matters. So next, even my wonderful colleagues here, if you guys could sit up nice and tall, I'm going to literally go through just a couple of exercises, not only to keep that are more so senior based to help with balance and core and whatnot, but also say, you guys, if you're working on your laptop nonstop, don't you feel it when you get up, right? This way, you can do a quick little 10-minute routine and be done. I'm even gonna kick my heels off. Give me 2 seconds. So I want you to think of form first and foremost. I want you, if you have a back to your chair, get off the back of it. And I want you to sit up with your shoulders down and back, plant your feet in front of you. Try to have your knees in line with your ankles. So you have a 90-degree bend in that foot and keep your heels planted. While you're there, again, shoulders down and back, think even belly button to spine. I want you to lift your heels off the ground and back down. So you should be engaging your calf muscles. Are you guys doing it?
Yes.
I wouldn't know if you could. I can't see it, but you know you're hurting. So again, this is going to work the calf muscle. And even if you try to squeeze the back of your tops of your legs, which is called your hamstrings, you should feel it back there too. So just keep going, lifting the heels up and setting them down. So just a couple. Try to do as many as you feel you can until fatigue. You want it to kind of burn a little bit in the back of those calf muscles. So that's really what it's doing. It's also stretching out the front shin. So that's always helpful too. You guys feeling good? A little bit?
Yeah.
A way to sneak in a little bit of core, which is great for balance with those shoulders down and back. Lean back slightly with a tall spine, and then go ahead and lift up the heels. Now you should really feel it in the lower abdominals. Yeah?
Yes.
Oh, I heard it. I heard the moans. It's okay. It's working, baby. And to go a little further, again, I like to compound movement. Still lifting those heels. Press your palms together and literally just twist back to center. You should really feel it in the side core, your obliques, and then other side. You should still tall back and lean back just slightly, but still with really good posture. You guys feeling it?
This is good.
Good. Don't forget to breathe. Your muscles need oxygen. Nice deep inhales, exhales. Just one more each side. Another tip, the more you push your palms together, the more you will engage your abs. All right, come sit up a little bit straighter. Now I want you to bring your arms out all the way. I have really long arms, I'm sorry. And again, still sitting up nice and tall, shoulders down and back. I want you to give me little baby circles forward. When I used to teach classes in person for senior sit and fit classes is what I called them, they always got excited when I said, we're not going to use any equipment. And then they would be deceptively challenged when I do a whole lot of arm movements with your arms up. The more you keep your arms up, the more you're going to feel it. You can work every angle of the shoulders and the chest. It's beautiful. All right, reverse it. Reverse that circle back behind you. This should feel good. A little bit of a chest opener. Keep breathing. Deep inhale and exhale.
That's good.
Good. Good job. All right, hold it center. And now what I want you to do, I'm actually going to let you see my palm. I'm knocking over pictures, sorry. I want you to go palm up, palm down. That's it. Palm up, palm down. Give me a really good rotation. I still want your arms to be in level with your shoulders. So you should really feel it. You should really feel it in your shoulder. It doesn't matter which way, just as long as you're going front and back, whatever way, as long as you feel it, you should really feel it on that rotator cuff on the top of the shoulder. Yes. Feel really good? Nice. Yeah. Keep breathing. Nice. Inhale, exhale, just a few more. Good. And 4, 3, 2, and 1. Good job. Ooh. All right. Now we all know that, I don't know if it's just women tend to hold stress in their hips. I'm sure men do too, but we're all tight in our hips, whether you're sitting all day or walking all day, no matter what, you're gonna have tight hips. So I'm actually gonna stand up to show you this, but please stay seated. And I want you just to lift one leg. And
I can't see you.
Can you see me at all? Hang on.
I see the other participants, but I don't see you.
Gotta
I can change
Can you
that.
better now? Can you see my leg now?
I don't. Does anyone else see her?
Yes.
You have to press the gallery. You have to move your pictures over.
Click on Adrienne Cordero.
Okay.
Okay.
If not, then just listen. But I want you, again, while you're seated, you don't have to stand up, just lift one leg up and rotate it open and back down. All right. And if you're seated, then you're going to go kind of out and then back forward. Okay. You can do one at a time. So lift it out and open. It should feel real good right here in the inner thigh. And then front. You're literally just picking your leg up and rotating it open and picking it up and setting it back down in front. Still reminding yourself to keep your belly button engaged to the spine. and nice tall posture with your shoulders down and back. You guys feeling it?
Mm-hmm.
All right, just one more on this side. Bring it back to front. Switch to the other side. I think we did about 10. So same deal. Out and then back in. Again, rotate the hips out, rotate back in. To me, this feels so good. It's a nice stretch. And if you really are tight in your inner thighs or your hips while you're sitting down, you can take one leg out, keep it out, and just kind of twist into it, or rather twist away from it, pushing that leg, the inner thigh away from you, and you should really feel a good stretch in the inner thigh, okay? All right, we're just 2 more, I promise. You do not need this, but if you were to go to Target or TJ Maxx or Marshalls or even Amazon, you can have what's called a TheraBand. This one has little holders. You're not going to use them. You're literally just going to bring your hands right in front, and you're just going to pull, squeeze those shoulder blades together, and then back in front. So without that, you're literally just pulling, like you're squeezing your shoulder blades together. Think like you're holding a pencil back there and you don't want it to drop, and then back to center. So squeeze, deep breath, inhale here, exhale on the work. Good. You guys feel your upper body feeling nice and strong? I didn't hear you.
Yes.
Yeah.
Sorry, it's the endorphins. Keep going. Let's just do 2 more. And breathe. Good job. All right, another thing you can do, I'm actually gonna stand, and if you guys are able, go ahead and stand and just have the chair either next to you or in front of you, whichever way you would prefer. If not, you can sit in the chair, actually just you're gonna go up and down a little higher. So what I want you to do is just a baby mini squat, shoulders down and back, make sure belly button into spine, hold on to that chair. Again, this should be able to help with some balance, but also to get you up off the chair. So I want you just to bend the knees, make sure that your feet are hip distance apart. Try to think of squeezing the butt, squeezing the glutes before you come up. And then push the hips forward, stretching out the front of the body right here, which are the hip flexors. And bring it back down, baby squat. You don't need to squat down too far. Squeeze the glute, nice and slow, come up. And push the hip flexors forward, stretching it out right here. Good. Just 2, 3 more. Again, nice and slow. Slower is actually better in fitness unless you're doing cardio-based movements. But this way, you're really focusing and targeting the muscle you're working. Good job. Keep breathing. Last one, squat it down, baby. Squeeze the booty and push it up. All right. How you feeling?
Good.
I think I'm going to be a little sore later.
And then that also takes me to my next point. You should never skip stretching. We really and truly a great way to do a quick stretch real quick while you're sitting down. Try to take one leg like can you see me at all? Still again. Okay. Take one leg and just kind of let the knee fall to the side. Keep the foot flexed. Inhale nice and deep and then bend forward. You should really feel this in your outer hip right there. Ooh. And it's really good for low back pain too. Like a lot of times you may have low back pain because you have tight hips. So just keep in mind, stretching is just as important as the rest of it too, you guys. So any questions about any of the fitness moves that we did today?
Yeah, those are great.
You offer personal classes or group classes or anything like that?
I'm more than happy to do that. Again, this is something I do. I did it kind of in my past, but I still keep up with my certifications. But you're more than happy to help get whoever you need to. If it's not me, I'll make sure to find someone for you. Okay.
Thank you.
Of course. All right. So as I was saying previously, it's so much more than just the physical aspect, you know, and some people, you know, they think that if they just work out that everything will be better. There's so many things that, you know, working out does do for you, obviously. But you got to make sure that you do so much more than that. You know, take deep breaths, as we were talking about earlier. If you have issues or stress, talk to someone about it. There's plenty of support groups like Christina's support group. That's wonderful. Get outside, start a journal, drink tons of water. Water is amazing for you, of course. Try to get enough sleep. Maybe learn a new hobby, or, you know, so again, the reason why I've been passionate about exercise for so long is because there's always a new way to do it. You know, whether Pilates, yoga, HIIT, you know, I think I took up pole walking for a while just to try it, just to say I've done it. So there's nothing wrong with venturing out and just reinventing your old hobby. So it's something new, and it'll keep your mind sharp, not just your body. It'll keep everything sharp. And again, who I work for, of course, is Vieira and Rockledge Rehabilitation. Some of the things that I did is not even close to what my therapists do at both Vieira and at Rockledge. So again, if you or your loved one or a senior that you know did fall and fracture a hip, or, you know, had a stroke or what have you, our team of therapists, whether it's physical, occupational, speech, respiratory therapy, the whole shebang, they absolutely know how to work the mind, body, and spirit to really help you prepare to go home. So that's it for today. Any questions?
Yay.
Thank you.
Thank you so much.
Thank you.
Absolutely, my pleasure, you guys.
Okay, Adrian, if you'd like to stop sharing your screen now.
Yes.
Thank you very much. And then I think if everybody's all set with Adrian, thank you so much. That was spectacular. I think my arms are going to be just a little bit sore. I haven't done a lot of straight out things for a while. I could really feel it. I don't know about the rest of you, but I could really feel it the last 2 or 3, specifically the last 2 or 3 that she was doing, you know, that we were doing as I was doing them. The last 2 or 3 were really kind of a little bit of a stretch.
Well, good.
So Adrian, could you move over the host to Christina Texan?
Yes.
Okay. And hover over her name to more. There we go.
It should be good.
It's gonna
See if this works. Share.
Fabulous.
Okay, you can see my screen now.
Mm-hmm. Yep, there you are.
I guess I'll put it on next slide.
Perfect.
So yeah, so my name's Christina. Like I'd already said, I'm a social worker, and the main organization that I'm working with is a complementary cancer care, providing different support services for cancer survivors, whatever phase of treatment or recovery, and caregivers, so anybody affected by cancer. I myself had breast cancer 5 years ago. It was the whole reason I went into social work, really. So as I go through some of the benefits of peer support and just networking and all, I'll kind of share with you just little tidbits of examples, because I really think it's really all about just making connections with people and letting that, you know, being authentic and real, and having whatever kind of release of your own emotions that you need to have to feel healthy and whole. So as far as support groups and any kind of peer support, it sometimes, like on TV, everybody's impression of a support group is just a bunch of really sad people crying or depressed. And that's not the case. That wasn't my experience at all. I was kind of a support group guru during my cancer experience. And I can honestly say it made worlds of difference and changed my outlook on my whole treatment time for breast cancer. And I've made like some good friends through that process too. So a lot of times it's, you're going to need the people that go there. Sometimes it's not that they don't have support in their own lives. It's that they just want to be around people that are similar circumstances, think the same, or maybe they think different, getting different perspectives, kind of exchanging stories and information. A lot of times they have a whole army of support at home, but sometimes you need to kind of censor yourself, shield your loved ones, because you don't want them to know how something is really affecting you. And that goes for caregivers too. You're taking on the, emotions from your loved one who might be going through an illness. And so you need to take care of yourself. So a lot of times support groups are good for that. And the friendships that you can form if you really are kind of become a regular, or just go to different activities and make connections. I mean, I'll tell you, I still keep in touch with some of the people that I went through breast cancer treatments with at the time. And now we talk about things that aren't cancer related. And I just really have better friendships because with these people, probably share more with them because we went through, such an emotional experience together. I have one friend actually that, unfortunately, just last week, she had a recurrence of cancer. And I was so fortunate that she called me and talked to me. This was in California where I was treated. So we're long distance now. And I'll tell you, I called another friend after I talked to her because I needed support for myself. After, kind of trying to pump up the one friend who's going to start treatments again. And, so it comes and goes full circle a lot of times. So when you go to these different groups, there is research that lets you know that it reduces stress, depression, and anxiety. It can make you feel more hopeful, and it help you manage your emotions better, and just give you a sense of control over your own health. Even different activities like, the exercise programs and nutrition talks. We do at Complementary Cancer do a lot of art programs and writing group. Just having your own kind of calendar of activities and meeting with people, that gives you a sense of control, which shows in your attitude. So it lets you know what to expect during treatments, how to manage side effects sometimes, how to communicate with your healthcare team, because a lot of times you don't really quite know what to do as far as thinking ahead. So just talking to people in similar circumstances or maybe a step above you helps a lot in that way. There's different types as far as peer-led. Sometimes they're a little bit more informal, could be a little bit more social in nature. Professionally led with a social worker or counselor of some type. Stuff I do now. And sometimes they can be a little bit more structured. And then sometimes there'll be groups where it's just a guest speaker, especially when we were meeting in person. Complementary Cancer Care did a group where it was just a guest speaker each time. And then, of course, there are groups that are specific to your illness or condition, or phases, sometimes age groups. I did a group that was for young adults at the time, and I felt like I had more in common with those individuals in some ways, so that was super helpful. And there's groups out there for caregivers, whatever different conditions. We do one for cancer caregivers. I know Sunflower House has done caregiver groups in the past, and even people who are transitioning after caregiving. So just a matter of kind of looking and seeing what's out there. I kind of give this as my my guidelines when I do groups. We're trying to create a safe, stable, comfortable, and productive environment. We're not giving medical advice because we all know that every situation is different, and remind people to check with their doctors, but definitely hearing from other people's experiences is helpful. Whatever you're saying is confidential, and depending how structured of a group it is, a lot of times it'll be kind of a process where everybody is in a circle and you go around the circle and everybody has a few minutes to speak whatever's on their mind. They call it a check-in, just to ensure that everybody has a turn. And I know it's always helpful for people newer to the group or just anybody that doesn't want to, that doesn't feel comfortable talking in large groups or as freely and openly. So the check-in kind of ensures that everybody gets a chance to speak. And then we always just remind everybody not to interrupt and that you have a right to tell people that you don't want feedback. You might just want to get something off your chest. So allow for differences, allow for silence, allow for tears, and allow for laughs. Especially now with COVID, there's a lot of online support opportunities out there. Sometimes it's just, you can subscribe to a mailing list of different people's questions, and that might be sent to you every day or every week or month. A lot of times you can, with different organizations, you can set how your preferences. Discussion groups and message boards of going online to different organizations. And a lot of times they'll have questions online and then you can read the answers. And then chat rooms where everybody's typing something in real time and you get answers that way. You just want to consider your own needs and personality when you're picking what kind of group is helpful for you. Some people don't like support groups, and if somebody like my dad, that would not be his forum of expressing themselves. But so everybody's different. So do you need a emotional support, information, education, or a combination of both? Do you prefer sharing your experiences with a group in person, or do you prefer an anonymous environment such as online support groups? So just things to kind of ask yourself. And finding one, talk to your doctor, your healthcare team, ask a social worker. They know a lot of times. Just go online and search, cancer or dementia, whatever mental illness, and you can find different organizations out there. I just did a search for a client and was hooked up with the National Alliance for Mental Illness. And they've been really great. And I just, as a social worker, I just found that as a resource and I was able to pass that on to one of my counseling clients. And ask other patients however you can. If the groups aren't your thing, a lot of organizations have buddies or mentors where they will connect you with somebody. A lot of times it's national. I know for cancer, there's a few organizations out there that have a database of volunteers who are willing to talk to people individually. And a couple of clients through the cancer organization that was really helpful to them because they had a little bit more rare cancers. So they had a good idea of what to expect coming up. Just talking to any of your friends. Don't stay isolated, especially if you're feeling, just feeling like you want to connect with people. Don't be afraid to talk to your friends. A lot of times they want to help you, they just don't know what to say. So all you have to do is just open up conversation that way. Individual counseling, people like me with some organizations, a lot of them have social workers or just somebody who's that's kind of their thing, and their strength is talking to clients, or talk to your doctor and get a mental health professional to set up counseling with, and just participating in different activities that you enjoy. There's a whole slew of them. There's lots of exercise stuff that my organization does. I know Sunflower House, at least back in the day when we were meeting in person, they did programs in their room there. So just keep doing things that you enjoy and connecting with people. There's all kinds of arts and crafts things, a lot of times cooking. It may take a doctor to diagnose you. It takes a friend to recognize your suffering and a fellow survivor to understand. Just to briefly go over kind of everything that we talked about. Just be curious and sincere about everything, and just know that people inherently want to help. At least I believe that. It's all about karma and kind of everything coming full circle. So even if somebody doesn't get back to you right away, advocate for yourself, follow up with them. They might have just forgot or it slipped their mind. I think when you go through any kind of illness or situation, especially, you want to help others. So I think it's part of the healing process too, of going to groups and helping people that are in a place where you might have been, kind of sharing your wisdom that way. So people want to help. It's just a matter of finding the community resources. So check with hospitals, community organizations, different clubs, online, go to different speaker presentations, even like this online thing. Sometimes, a lot of times they're just reminders of things you already know. I already know to eat healthy and exercise, but I needed Jane and Adrian to remind me, so that was good today. So it's all about sometimes just empowering yourself and getting those little reminders and staying focused. Even when you already know the information, attending the speaker and education presentations gives you good reminders, puts you in a good mood, helps you stay focused, and is empowering. And this is just a list of a few organizations that are sometimes my go-to places, just to keep in mind. I won't go through all of them, but I mentioned the National Alliance on Mental Illness for serious mental illnesses. I think that was really helpful. There's Resource Center for Disability Solutions. Anybody that has different types of disabilities, they've been always helpful reaching out. St. Francis Reflections and a lot of the hospice organizations, they have a lot of different groups. There's griefshare.org, where you can find groups all over the place. There's a couple senior resources, One Senior Place and Senior Resource Alliance, 211 Brevard, just overall for the county. Health First and Parish and any of the hospital websites have a lot of different resources and groups that they can tell you about. And of course, Sunflower House and Aging Matters, and then my organization, Complementary Cancer Care, for anything cancer related. This just lets you know different classes and groups that Complementary Cancer Care has. And then just check with different organizations that might have similar things. And for us, you have to go to our website and mostly register so you can get the Zoom links, but at some point we'll be meeting in person again as well. And we also have a oncology nurse who can talk to you about treatments if you have those kind of more specific questions and want to walk through that sort of thing. And then of course we have our caregiver support group that meets monthly. Right now it's on Zoom. At some point maybe it'll go back to meeting at Sunflower House, but every first Tuesday of the month from 11 to 12:30. That's it.
So thank you so much, Christina. Appreciate it so very much. I think that, all right, so does anybody have, I think we'll wrap back around and ask right now if anybody has any questions for Christina.
I do.
Okay, Jackie, go ahead.
What is the caregiver support group? She just had that on. How do you do that the first Tuesday of the month? Is that the same one here, or is this something else?
It will be, yeah, the first Tuesday every month. I can get your information and send you the Zoom link, or you can go to our website. And actually for our support groups, that's the only thing where we don't have people register in advance because we try to leave it more open. So I think our website probably says just to contact us for the Zoom link anyway. If you want to email info@compcancercare.org, COMP cancercare.org.
Okay.
Then yeah, I can definitely get that for you, and we'd love to have you come.
Okay, thank you.
Fabulous. I want to remind, I noticed Christina had Brevard Alzheimer's group was listed under the okay, wait, Adrian says she needs to scoot because she's got another meeting, and it's 3 o'clock already. I wanted to just remind folks, and I'll wrap up a little bit here, letting folks know that Brevard Alzheimer's, ALZ.org, does have some support groups going on too. And I think several of the folks that have joined us on again, off again, are dealing with people that they care for that are dealing with memory issues, and whether or not it's specifically Alzheimer's or it could be different forms of memory loss and those kinds of things. You know, hook in with some of these folks, and then I think that you'd be surprised how many of it, if it's not the perfect fit, somebody's going to be able to help you to move into a different one. Give me a call. I'm pretty sure that everyone who's on this today has the last Outlook invitation that I sent, reminder that I sent out this, I think it was yesterday, or it might have been, it was within a few days. It has everybody on it. So feel free to email me if somebody in any one of these classes or these units, you want to be able to reach out to any one of them for the past 4, or if there's somebody from today. Everybody has my email and my phone number. Give me a call and be in touch with me. We're going to be, please let folks know as we move forward that we're going to be hopefully redoing this whole workshop series again in April. So if you hear of anybody or Mona, you just barely joined us and you didn't get a chance to go through the first 3 workshops or the first 3 units. We're going to be doing this again in April. Good. And so I will certainly keep your email, and I will send that out. I will also, Frank, send it out to everybody else who's joined, just so you can pass it along to somebody. And we're going to continue to keep this online. Hopefully, maybe not in April, but hopefully by July, we'll be able to start to maybe even do some of these things also live and in person if we can get back into the real life thing. But I do want to continue to do a lot of these online because I think it does help folks who can't necessarily, you know, it's not just an hour to go to these things. It's the whole prep time. It's finding somebody to take care of your loved one if you're in the middle of caregiving. It's getting up the gumption and getting in the car and getting over to Sunflower House, and so it's not just, it says, oh well, just an hour a week. Sometimes it's more of a commitment than that. And I know what my mom was, I've said before, when my mom was caregiving, if she had an extra hour to spend, many times her priorities were not necessarily on something exactly like this. She might have used it to, you know, go grocery shopping or a doctor's appointment of her own or a dentist appointment. So I want to make sure that we're continuing to do these sessions online because I think they can be a little lower impact on people if they can just scoot away for a little bit of time to get online. I thank everybody. And I want to thank Jane and Christina and Adrian, who's left, and Lana, who's hung in there too. So I want to thank everybody for joining us and helping me facilitate these as we've gone along. And I appreciate everybody. Please know that you can continue to reach out to me at any point at Sunflower House. And I look forward to hearing from each one of you soon.
Thank you very much. It's been very good.
Oh, sure, Jackie.
Do you all have, my mom just got a letter yesterday that her doctor is dropping her because she didn't show up for her last appointment.
Ooh.
and very rude. And I even called them and they were just like, well, she didn't show up. And do y'all have a doctor you recommend in this area, or is it just I just need to call our insurance company and pick another? It's just so hard.
Personally, I would suggest getting a hold of her insurance company, because if she's got an insurance company rather than Medicare, you want to make, or, I want to make sure whatever it is in network, and you want to make sure that they accept if she's got Medicare. I mean, most of the doctors here do, but my suggestion, maybe Jane would have or Christina would have a different take on this, but my suggestion would be to get a hold of her insurance
I
company.
did. They're going to send me a giant list of doctors.
Yeah, I know. I know.
Oh, well.
So.
Yeah, and something you can do is when you get that giant list, is if she has another physician, maybe a specialist in some area, ask them, here are the folks I've been recommended. Do you recommend anyone? So, that's one way, is to ask other practitioners. Some folks put it out there on the neighborhood sites just to see what kind of feedback they get. Look at the reviews online. Those are, pretty new in the last 10 years. And they're very helpful, particularly when there's just so many folks in an area like we have.
Yeah. I would also suggest, I know it's a lot of work to do it, but when Mike and I first came to this, to setting up our PCPs, because we're new to living here full time, we actually interviewed our doctors, and we actually, you don't have to go. I mean, it's a lot of work to go through to set up with another one, but don't feel like you need to stick with this first one you came with. Frankly, whether it's your insurance company or Medicare, we're paying them for their service, so they need to be a good fit for us.
Right.
So I think it's perfectly okay to keep looking until you have one. And again, this would be a great suggestion if you can get in with a support group in Brevard County or in this area, you can ask those folks, hey, who would you suggest?
Right.
And that would be what I would. Those would be the things that I would say. But at least if you had the list from the doctors, from the insurance company to start with, it would at least give you some parameters.
Okay. Thank you.
Okay.
Thanks very much.
I wish everyone well.
Thank you so very much. Thank you very much, Kathy and Mona and Jackie, Lana and Christina and Jane. And we will hope that everybody has a great rest of their afternoon.
Thank you very much.
Thanks.